Good evening. Tonight we're going to reflect on understanding veteran suicide, a family therapy perspective. As marriage and family therapists, we understand suicide not as an isolated individual act, but as a systemic outcome shaped by relational, cultural, and contextual factors. When we consider veteran suicide through an MFT lens, the focus shifts from individual pathology to patterns of connection, meaning, and belonging within family and border systems. Veterans often return from service carrying trauma, moral injury, or traumatic brain injury while simultaneously navigating reintegration into family systems that have adapted in their absence. Changes in roles, boundaries, and expectations can create misalignment. Families may interpret withdrawal or emotional numbing as disengagement, while veterans may experience these same behaviors as survival strategies rooted in trauma. Military culture often emphasizes strength, emotional restraint, and self reliance. Systemically, these cultural narratives can reinforce stigma around help seeking and contribute to relational isolation, one of the most significant risk factors for suicide. From a family therapy perspective, suicide frequently reflects a collapse of relational safety rather than a failure of coping or character. Prevention, therefore, must extend beyond symptom reduction. Systemic interventions prioritize strengthening family communication, increasing emotional attunement, and addressing meaning making processes following trauma. Family therapy can help normalize trauma responses, reduce blame, and re-establish connection as a protective factor. At the community and institutional levels, MFT informed prevention includes integrating families into veteran mental health care, providing culturally competent trauma-informed services, supporting identity reconstruction during the transition from military to civilian life, and creating continuity of care across systems. When suicide does occur, the family system experiences a profound rupture. Survivors often present with complicated grief, trauma responses, and disrupted attachment patterns. A systemic approach recognizes the family itself as the client and focuses on collective meaning making, emotional regulation, and relational repair. Therapeutic work includes addressing guilt, blame, and family narratives that assign responsibility, while helping survivors honor the veteran's life and service. Importantly, families benefit from reframing suicide as the result of intersecting systemic factors rather than individual failure. In conclusion, from an MFT perspective, veteran suicide underscores the necessity of relationally focused prevention, family inclusive treatment models, and long term systemic support. Healing and prevention occur through connection, collaboration, and compassion, core principles of our field. For immediate support in the United States, veterans can contact the Veterans Crisis Line by calling 988 and pressing 1, or just by texting 838-255. Thank you.